How about now? Okay, I'll start over. Welcome. Calling to order this meeting of the Assembly Housing and Homeless Committee. It is Wednesday, December 17th. It is 10:49 a.m. We're going to get started. I know there's a few members that are running late, but we're going to go ahead and start. We'll do roll just on the phone. Mr. Johnson, are you there?
Yes, I'm here. Thank you.
And Ms. Baldwin-Day, are you there?
Yes, I am.
Thank you. Go for it.
Jared Gerker.
Great. And this is Cameron Perez-Verdia. Okay, so we're going to get started. We have our first item on the agenda is the Anchorage Health Department. If you'd like to go ahead and come up. And actually, folks from the mayor's office and others, there's plenty of space up here. Why don't you just come on up? That way we don't have to wait for you in the transition. And introduce yourself for the record, and whenever you're ready, you can get started.
This is Jed Drolet, Community Systems Program Manager for Anchorage Health Department.
Kimberly Rash, Anchorage Health Department.
Okay. So yeah, we'll go ahead and get started with this presentation about emergency rental assistance, outcomes, and performance. Can I have the next slide, please? Okay. So for this presentation, I'm going to give a brief overview of the ERA program, then look at the spending and outcomes, actually both collectively for the program and by grantee, some of the feedback that we got from grantees, and then the commitments that our program is making based on lessons learned from how we've done this program. Next slide. So just high level overview, and this is, to be clear, and this is on the agenda here as well, but just want to emphasize, this is the ERA2 tranche 3 funding only. There's previous funding. There was ERA1 and then ERA2. ERA2 was split into 3 different tranches, and our program only managed the third of those. So this doesn't take into consideration the previous funds from ERA, just that tranche 3. So tranche 3, we got about $4 million total. And we ended up spending about $3.2 million. So we just, fair warning, fair notice, we will be returning some money to the Treasury. And I'll go into some of the reasons for that later in the program. But we did spend most of it. And tranche 3, we had a very compressed time frame because we couldn't access tranche 3 until we met a certain spending threshold of tranche 2. And by the time we hit that, it was about March of this year. And then there was a very hard deadline for all ERA funding of September 30th of this year that we had to spend it before. And so that was kind of a major constraint on how we set up the program. And that is one of the reasons that some of the money did end up not being spent. Next slide, please. So client served, in this case, we actually exceeded expectations. We had originally projected based on the amount of money available in tranche 3 and approximately what rents tend to be, that we would serve about 600 households with rental assistance. We ended up serving 717. So we did exceed our projection on that. And so that was some good news in the operation of the program. Next slide, please.
Actually, one quick question. Yeah. Those are unique households.
Unique households.
Okay, thank you.
Yeah. And so spending and outcomes by grantee. So I have next slide, please. So this is a little bit of a busy slide, but this just kind of goes over who our grantees were. These were awarded through a competitive process that we actually already had ongoing at the time we gained access to the tranche 3 ERA funds. And there was a lot of overlap between the other funding that we were allocating through that process and the ERA. So we added the ERA to that process and selected 6 grantees. One of the grantees, United Way, had 3 different awards for 3 different programs that they were doing. But those were Anchorage Coalition to End Homelessness, Choosing Our Roots, Henning, NeighborWorks, New Life Development, and United Way. And three of those ended up spending all of their funding. That was Henning, New Life Development, and United Way. Henning and New Life Development actually ended up spending more than they were originally allocated because some of the other grantees notified us that they would not have the ability to spend all their funding in time for us to reallocate those funds. Particularly United Way let us know about that. And so we reallocated those funds to Henning and New Life Development, and they were able to spend them all. And this will be shown in the charts that I'll have coming up as well. The ones that did not spend all of theirs were the Anchorage Coalition to End Homelessness, Choosing Our Roots, and NeighborWorks. They have, they have reported their reasons for not spending them. I've just put these on this graph with the parenthetical. This is per the grantee. We haven't, looked into and verified, that this is actually what was going on. We don't have visibility into all of their internal processes on that. Although we are doing kind of an oversight process, particularly with the coalition. We did a monitoring visit there and discussed this with them. And we've had a lot of back and forth on their reporting on their spending that they did do. So that's been an ongoing process since the end of September when we learned, who was going to spend all their money and who was not.
And just for clarification, did we grant out all of the funds, but some of the providers were unable to spend it? And is that why it's
Yes.
short? Okay.
Yeah.
But we granted out.
We
the
granted
full
all
amount.
the funds. Unless we retained a small amount, $10,000 for our administrative costs, but the rest of the money was granted out. And then just some of the grantees were not able to spend it all.
Got it. Thanks.
Okay, next slide, please. So this is the awarded versus spent by grantee. And there's three columns here. Actually, you can scroll down a little bit so you can see the legend here. So the left column is the original award. The middle column is the award after that reallocation, when we heard that United Way was not going to be able to spend all their funding, and we reallocated some of that to Henning and New Life Development. And then the rightmost bar is the amount that was actually spent. And so you can see there that some of them are under, some of them spent all their funding, some of them that are under are under by different amounts. This is kind of the overall picture of both the initial allocation, the reallocation, and the ultimate spending. And I should note that some of these numbers might change a little bit because we are in the kind of closeout stages of processing all the reporting and determining eligibility of expenses that we haven't yet paid for some of these. Our deadline that we've set for the grantees to get all their final paperwork to us is December 19th. That's this Friday. Treasury's deadline for us to do that and get all that information is December 29th. And then our deadline to do all final reporting for the entire ERA2 program, including all tranches, is January 28th. So we'll get that reporting done. At that point, we'll know the exact amounts, and then Treasury will process those reports and let us know how much actually we will need to return, because they'll need to determine eligibility of expenses as well, based on our reporting to them. So it's kind of a complex reporting structure. The grantees report to us both their spending and then demographics of their clients and things like that, and then we compile all of that and report it to Treasury. Next slide, please. Yeah, so here is clients served by grantee, and so you can just get a sense of kind of the different numbers of people. United Way, again, had 3 different awards for 3 different programs, so they're particularly high. That this includes all of those. They served about 300 people total. Henning served about 150. The other ones served lower numbers, but in part that was because they were targeting more restrictive demographics. In some cases, they were prioritizing particular groups, and so some of those groups are just not very large, and so they were designed to sort of fill a niche, whereas others were more sort of broad based. Next slide, please. And then this is just a quick calculation of the cost per client served. And so this is just those two numbers divided by each other, basically. And so this is like a rough cut sort of cost. It's not, it's lumping in the costs for administration and supportive services and some other costs, not just the direct rental assistance. But this is kind of a sense of how much each of them spent per client for rental assistance. And you see they're mostly pretty similar. They're spending about 7,000, some of them lower, either because they were, targeting a particular demographic or serving more people at, a simpler program and things like that. And so, I mean, and again, this was over the course of about 3 months. So you kind of get a sense there that, if you divide these by 3, that's about how much they were spending overall per month on rental assistance.
So, and you had said that there's probably more data when we don't have to talk about it today, but I am curious about what the metrics are in terms of, what we're using to determine whether it was successful or not, the longevity of the stay and all those kinds of things. Those are part of the data sets that these folks are required to.
Yes, there's a very specific set of reporting metrics that Treasury sets that we have that data and that we're reporting it. So we'll be able to provide more in the future. Next slide. Grantee feedback, next slide. So this is just some things that we heard from the grantees about their experience with the program. The main thing was the timeline. It was set up in a very short time, and there was definitely a lesson learned, and there are things that could have gone smoother without. It's also kind of a complex process because our decision on how to do it, and this was partly because we had that ongoing competitive process to select these grantees for a different funding source. We were selecting multiple grantees, trying to reach multiple demographics, multiple sort of niches within the overall need for rental assistance. And the way we ended up structuring that was to have each grantee taking in their own applications. And then if they determined that they were eligible for the program, but not a good fit for their own priorities, that they could distribute those on the back end to other grantees and they could process them. And this did work. And we got people, we got probably quite a few more people than we would have otherwise served by reallocating those applications on the back end. But it was quite complex and was a lot of work both by our staff and by the grantees. And so I think one takeaway from this is that it would be better in similar programs in the future to have a single point of intake for applications, whether that's within the health department or maybe have a specific grantee, have that be part of their agreement to do intake for all of them. Something like that is one of the pieces of feedback that we got from grantees and the lesson learned that we'll try to take into consideration in future programs. There was also a lengthy approval process because they had to check to make sure people hadn't used all of their eligibility through the overall ERA program. ERA had a restriction on how many months of assistance someone could get from all ERA funding, not just tranche 3. And Alaska Housing Finance Corporation has a database they maintain that tracks that. And so we had to have a process in place to whenever a application would come in, one of the first steps is that would have to go to AHFC for a check of the database to determine if they were eligible based on prior use of the program. Because there have been several different iterations of ERA funding through different grantees, both from AHFC and from the municipality. And so they had to do that centralized check. And that was a bottleneck in the timing of getting money out the door that the grantees did note was one of the reasons for being underspent, was that they weren't able to get applications through that check process in time to get the rents paid, because there was that hard deadline of September 30th, after which they couldn't spend any money. So wasn't really anything we could do about that process in this case, but it is something to note about how this program worked. And then another issue that some grantees flagged is that it was hard to find landlords in some cases for this assistance because it was just short-term aid because of that expiration, that September 30th cutoff. They couldn't provide like a year or two lease with full coverage of rent. So it was very hard for the grantees that were working with, just regular commercial landlords as opposed to like supportive housing providers or other types of landlords to find units with landlords that were willing to take just a month or two of rent with no guarantee that there would be continuing assistance. And we've worked on allocating other funding that we have to provide continuing assistance for kind of the highest need clients, and we do have that in place. And so, we haven't been hearing about people losing their housing, getting kicked out in droves, which we were worried about at that September cutoff. But it was an issue in finding units, is reassuring landlords that they weren't going to end up in that situation. Next slide, please. Yeah.
Let me pause you for a second. We were joined a few minutes ago by Mr. Rivera. And just as a reminder, those folks on the phone, if you want to get into the queue, just send me a text on my cell phone and I'll pause and take your question. Yes, Mr. Greco, yes.
What does, when you say you're trying to reassure landlords, what does that look like? Like, walk me through those efforts. Like,
Through the chair, Member Kukra, I really couldn't answer that. That would be something we'd have to ask the grantees because they're the ones that were really handling that process. But I'm sure they would have a lot to say on that. What they do to do that. It is an ongoing thing with many different programs. It's not limited to this. It was just particularly extreme in this case because of that short duration that we couldn't really do anything about.
Yeah. Okay.
Next slide. So this is just some of our commitments for future programs, lessons learned from this, transparency spending. We're trying to be very transparent about this, including warts and all, including the grantees ended up underspent. More on-site visit and oversight, I think, in retrospect could have helped with the spending issue. I think we could have caught some of those like delays and issues with getting money out the door if we had exercised more on-site oversight and monitoring, which we have the ability to do through our agreements. There's just kind of a balance there about how much to focus on that. And increased collaboration with community partners, just getting more organizations involved, getting the word out about one challenge was just with the short timeline was getting the word out. We had to stand up an application system that was quite complicated, and getting the word out for people to apply and those sorts of things is something we'll want to work on in the future. Next slide, please. Okay, so that's all I've got, and I'll take any questions.
Good. Yeah, I mean, I guess I just have first, I just want to express, I'm sure you feel the same way, but just real disappointment in the fact that we're sending the money back and that this is money our community needs. And so I just wanted to put that on the record. That's really disappointing. I understand the circumstances around it but it's a hard pill to swallow to see us giving money back that we could potentially have used. And so I'm really looking forward to seeing some of the data around this and what we can learn from that. The clients that were served I'm particularly interested in the sort of longer term sort of arc of that are they staying and what are because getting them in and getting them there for a short period of time is one thing. Allowing them to be there on a longer term is really interesting to me. And so when do you think we might be able to see some of that data and once all of it is collected?
Yeah, we'll have the final data from the program after that January deadline when we submit it to Treasury, and that does include some of that tracking of outcomes over the course of the program. So that would just be over the few months, but then we'll continue to follow up. We do have all of these agreements with these grantees also include other money that did not expire after September 30th. So we'll have continued reporting and tracking of outcomes for the duration of those agreements, which extend for various periods, but mostly through about the end of next year. And so we'll be tracking over that period. And we're also interested in doing more types of rental assistance. And so we're really interested in looking at outcomes from this program and see kind of lessons learned about how to do that with other funding sources that have kind of their own quirks. But yes, that piece about the longevity and how long people stay is a really key thing of interest.
So I think what we could do is probably provide an update at the March or April meeting,
Sure.
and then just do a shorter presentation of the closeout, the final closeout of this amount, and then working with the grantees that are still serving clients to then answer some of the questions that you have of like, how are they doing? Are they still on the, within housing? And then perhaps at the very end of next year, after we close out the HUD funding that's attached to this for the tail end, we could do that as well, if that works.
And I have someone in the queue. Let me just say one more thing real quick before I hand it over to them. That I'm also really interested in just learning more about what the providers are doing and if their services are different in some way. And I think this is something that our community wants to continue to invest in and do well. And so not only us learning from them, but creating a space for them to learn from each other and exchange information and that sort of thing. I have a question from Ms. Baldwin-Day.
Thanks, Chair. Could somebody turn off their microphone? There's a little bit of feedback happening. Oh, perfect. Thank you. So I have a few questions. I think the first is I'd like to understand what contributed to the complexity of the application for clients. I'd also like to know how frequently throughout this process the health department was actually interacting with the grantees, because it sounds like maybe some of the bottlenecks didn't emerge for a little while. And so I'd like to understand what that interface looks like. And then I think what I just heard, and so this is question 3, I think what I just heard was that there isn't actually data available now on how many of the folks who were served by this particular tranche of funding are still in housing. That is unknown to us right now. And I would like to know why we don't actually know those numbers, seeing as it's December and this program wrapped at the end of September. And whether or not that was even an expectation, perhaps it wasn't an expectation in the data gathering from the grantees themselves. But I'd like to know what the data expectation looked like for grantees. And then, yeah, I think that's a good start. That'll do for now.
Through the chair to Member Baldwin-Day. I'm going to start with the third question there. Actually, just to clarify, no, that data does exist. We do have it. It's just not included in this presentation, but that's something that we can provide sort of a snapshot of what we know now, and then we'll have updated numbers sort of as these programs continue. And let's see, can you remind me of your first 2 questions?
The first question was about what contributed to the complexity of the application process for clients.
Yeah.
And then
what the interface was.
Go ahead,
between, what the interface was between us and the grantees. Yeah. So the complexity of basically the way the complexity of the application process is that we had each grantee managing their own separate intake process for applications. So this was generally some form of online portal or application form that they would turn in that would include they would all include the same information, but would be submitted to different organizations. And so we had like a website that we set up that kind of gave information about the different grantees and their programs and tried to, and like a sorter sort of interactive thing that people could click through and determine, if they were eligible for the program, and then which of the grantees would be the best fit for them to apply to. And with a lot of like guidance to only apply once, because if they're coming in through different portals, then that was creating increased work for the grantees to match them up with the right program and make sure that they weren't duplicating benefits. Yeah.
One of the other things that happened, not very frequently, but some individuals forgot who they applied through. And so trying to track down the person with the organization and then their application. So sometimes that would occur throughout this process as well.
Yeah, there were a few cases of that. And yeah, there was, so there was just a lot of complexity and kind of a lot of duplication of processes for taking in what was essentially the same information. The requirements for the program were the same for all the grantees in terms of basic eligibility. So it would have been more efficient, I think, for everyone to have a single sort of intake point and clearinghouse that would route applications to the best grantee, rather than having them go in through one of several intake points and then have that routing happen in the background. And I think it was a successful effort in doing that routing in the background. It just was a lot of work. I think maybe more work than we or the grantees anticipated it would be to do that coordination. And that kind of also gets to the second of your questions, that we met weekly with the grantees for most of the program. That we had a standing weekly meeting with all the grantees, and kind of answered questions and went over sort of the processes of moving applications around between grantees and coordinating with between the different grantees. It turned out what our initial thought about that meeting was that it would be to actually do sort of case conferencing, sort of coordination around specific applications. That didn't turn out to be that necessary, because the grantees could do that pretty efficiently one-on-one with each other. They could take in an application that looked like a fit for someone else and then reach out to them, and they would take it and run with it. That actually worked pretty well, but we did have those regular weekly meetings. And then our project managers were in pretty much daily contact with the grantees about questions that would come up, reporting issues, eligibility issues. We did a lot of like checking the Treasury guidance on eligibility questions that would come up from grantees. So I would say it was a very hands-on sort of project management approach. And I think the issues that did end up coming up and the underspending issues, I think those were flagged pretty early on in those processes. There just were challenges in getting them resolved over time due to some of the complexities and some of the delays in aspects of the process, and then that looming deadline. So yeah, I think that hopefully I addressed all parts of that.
Yeah, no, thank you. That's helpful. Was Alaska Housing Finance involved in any of those meetings?
Great question. That through the chair, the member Baldwin. They know they were not, and I think that is a lesson learned that probably in the future it would be good to have them looped in more, because there was an indirect process for the checking of the AHFC database, where AHFC in this case wanted there to be only a single point of contact, and they wanted it to be an organization that they had already worked with on ERA funding, that they trusted and were familiar with. And so we determined that NeighborWorks was the best fit for that role. And so we designated NeighborWorks as the organization to do that check and reach out to HFC for all the applications from all the grantees. And there were some challenges with that approach. And so I think, having AHFC staff themselves more involved in our communications with grantees and our processes probably would have eliminated some of that bottleneck effect of that process.
Great, thank you.
Just for the record, we've been joined by Mr. Rivera in person. I don't see any other questions at this time. Do you have anything else you would like to add? Okay, thank you for your presentation today. Okay, we're going to move on to the next item on our agenda, which is the mayor's office.
Chair, for the record, Member Martinez.
Oh, thank you. I didn't see you over there. Mr. Martinez has joined us. Thank you. Have everybody come up. Great. All right, when you're ready, share your name for the record and you can get started.
Great. Good morning, everyone. Thea Agnew Benben, Special Assistant to Mayor LaFrance. One thing I do just want to comment on from the previous presentation, the reason the timeline was so short was because we had to reach a certain level of spending before we could get that third tranche. And it was really due to a team effort from Director Rash and our finance department that we not only figured out that we were close to getting it and that we actually secured the money. And then that left us, from that time until September 30th to get the money out the door. The health department, because I was working closely with them, did a Herculean effort. So Jed's team, I think, deserves a round of applause because it was awesome what they jumped into doing. And the fact that we were able to serve over 700 households, and from the data that Jed shared at a previous committee meeting, we know that half of those were people who were on the verge of losing housing, and half of them were people who were actually experiencing homelessness. Jed kind of passed over it, but also the way they structured this, the grantees have additional funding that can help with additional rental assistance for people that are in danger of losing their funding. And then the health department also was nimble in reallocating some of that funding to the grantees that served the most people who were coming out of homelessness, to make sure that the people who were most at risk of falling out of their rental assistance would have that preserved. So I want to make sure that in the conversation where, of course, we're concerned that we had to return some money, we also say, hallelujah, we had 700 households plus housed in a very short period of time due to some really remarkable efforts from the health department. So I'm going to actually start applauding.
Good job.
Thank you, Jed. Thank you, Director Rash.
Thank you for the additional information. And I think that I want to extend our thank you as well. And I think this is partly why I'm so curious about the data, because I think there's a lot of information about what happened, who we served and how they were served, that I think will really help us to understand the impact of this. So thank you for adding that. I appreciate it. And for the record, Ms. Silvers has joined the meeting on the phone. Thank you. Okay, go ahead and get started.
Great. So we wanted to provide a shelter system update. I just want to do a quick kind of overview, and then I'm going to hand it over to Kathleen from RRS. And then we'd also like to speak about our outreach work that's happening, that's being beautifully coordinated by the HOPE team, with also key involvement from RRS. So just a reminder, and I wish I had thought to get my diagram up on the screen that I think you've all seen numerous times now. And I can make sure that it's in here next time for the next committee meeting, because it's the picture of what we're doing here. So we have now 300 year-round beds that is municipally contracted. So those ones are the ones we really directly, I know. Yeah. So we have 300 beds, 100 at East 56, 100 at Linda's Place, and 100 at Alex that are year-round. So Linda's Place and East 56 are congregate. Alex is non-congregate. So over the last probably 4 weeks, we've surged in both East 56 and Linda's Place. We do that according to the demand coming into the system. So we meet 2 times a week with all of our shelter providers. And through the work of RRS, we're actually on a daily basis in contact with the safety center, all of our providers and our outreach providers. So we're monitoring the system on a daily basis. We were able to add surge beds. So up until last Thursday, we had 150 beds at Linda's Place, 150 beds at East 56. And that brought us up to kind of our limit. Wednesday night last week, as you all know, very cold and a wind. Started the beginning of the week and we were monitoring very closely. And Safety Center was doing okay. They were managing. Wednesday night, they hit capacity. So that's why we then asked the assembly through the emergency meeting you had on Friday to add another 25 beds at East 56. That takes us over our 150 cap. So that has to be a part of the emergency declaration, which thankfully you all agreed to do on Friday. And then you affirmed that last night at the meeting. So thank you for doing that. And what those 25 beds allow us to do is really decompress the Safety Center, which is really our first responder drop off. It's available 24/7. They're great partners. If we can't get someone in where we want to, we can take them there. They can wait there for a little bit and then they will coordinate transport and shelter beds. So that's where we're at with shelter, just from kind of a systems overview. And I want to hand it over to Kathleen to give maybe some more color and flavor to what's been happening.
Thank you. My name is Kathleen McLaughlin with Restorative and Reentry Services. Thea summarized what's happening. We are doing everything we can to triage everybody on a 24/7 basis. And I would say that the one thing that I've noticed more than anything this year than other years is that our integration and coordination is real time and we're getting people in. When an abatement happens or a move along happens, APD calls us and we make sure that that person has an option. We are not saying no to people. We're not saying no. It's ours to give a bed or options, and it's theirs to either decide not to continue them or to move along or to work with us. The reason that this is working is primarily because of the two people that are sitting right next to me. Ruth and Tanya and Emily and I have been working on a daily basis to try to integrate from the ground up. So one of the things that that causes is for us to be at capacity every night. And some people think we need to have that's a bad thing. My view is we should be at capacity every night, especially with the cold weather. We need to fill every single bed. We shouldn't have any extra inventory. And because of the way that we're integrating, we are causing every night for there to be a fill. One of the programs that I think is doing an incredible job is Anchorage Safety Center, because they are accepting people as walk-ins as well as from the emergency responders. And when we get to a tight top end of between 35 and 40, then we start triaging immediately. The one thing that we have now as a safety net is the Good Neighbor Fund. So when we do not have a shelter bed, we are putting people in what I would call overflow. So we're buying beds with Good Neighbor funds for a very short period of time so that then we can fold people into shelter when the regular attrition happens. Just yesterday, the United Methodist Church pastor called me, and there was a gentleman that's been out on the street for 10 years. He finally decided yesterday was his day to come in. We didn't have a shelter bed that made sense, so we bought a bed for one night, and he was folded into the shelter at Alex this morning. So that's what we're trying to do. A lot of people say that we say no. We don't say no. We say we need to figure it out. Ruth and Tanya, I think, have an example from yesterday that I think shows the kind of work that we're trying to do. I think, so the bottom line is, I think that the system is working and the integration is happening thanks to the partners that we are creating in the community. And I'm open for any questions before I turn it over to these guys.
Okay, I have a couple of questions, and I don't see anybody in the queue right now. Yeah, I wanted you to explain buying beds for us. And you used the example of buying a bed at Alex. Is that buying a hotel room? Is that buying a current shelter bed? What does buying a bed mean?
So with the benefit of Good Neighbor funds, we actually pay with a Good Neighbor fund amount to some of the more inexpensive hotels. So we partner with the QN With the Alex, they give us a smaller rate, I would say under market rate, and other hotels, so that when we have somebody particularly coming out of a camp who is not going to do well in a congregate shelter, we will buy a bed. So it would be a room with the Good Neighbor funds for that bridge. And then we will fold them into shelter or long-term plans from there.
Just want to add, this is Thea, just to be very clear, we have non-congregate shelter at the Alex Hotel. Those are not the rooms that Kathleen's are talking about. Kathleen's talking about in the second tower.
Yeah.
There are hotel rooms.
Thanks. And so that makes sense to me. I want to go on and have the Hope team be able to share, but I want to just hit a couple questions that came up during your presentation. The safety center, it feels like the safety center is our lowest barrier, easiest to enter, no commitment. I don't have to, and I guess it felt to me when you first said, hey, we're going to expand the safety center and we're going to open that. It felt like, yeah, like that's where we're going to save lives. Like that's going to be the person that doesn't want to go into shelter, doesn't want to do a lot of things, but is in danger. And there's a place to go. So I guess my question is, that feels like a really, really important service that seems to be at capacity. So, or is really being pushed. And when we're seeing colder nights and these kinds of things. And I'm curious about that long term in terms of what that looks like, whether that service needs to be able to surge as well, so that if 20 people, if we have a really, really cold night and 20 people are like, we got to get inside, that there's actually a space for them to go, and that would be the first space. Is that the most logical place where we would surge and bring even more in, and then triage them and figure out where they would go?
So that is the way the system is working. We've had one night where we met capacity. That was last Wednesday. We have not been at capacity before. So like when Kathleen says the system's working, that's what she means, is like we're moving people through. That's the goal. In 2026, South Central Foundation in June will open a crisis stabilization center with 16 chairs of 23-hour care and 16 beds of 2 to 7 day care. And then in October, Providence will open a crisis stabilization center with 12 chairs and 12 beds. So that's going to be a huge game changer for us, that instead of taking some of our most vulnerable and most complex individuals and kind of keeping them from dying by bringing them to the safety center, we're going to have at first one and then 2 more locations to bring people. That's going to make a huge difference. There's also discussion at the state level of making what's called a sobering center, which really is what the safety center is, a billable service. That's an example from around the country, and our state is looking into that as well. So if that were to become the case, we then, instead of it being fully municipally funded, would be able to do some billable services there. And I think that would actually quite potentially change what kind of care and how it's delivered. There's actually a national accreditation process for sobering centers that's being developed. So I think we might see some changes. Well, we will see some changes at the safety center as the crisis stabilization centers come online. But in the short term, what we really were planning on for this winter, and what Kathleen just described, as of yesterday, the Good Neighbor Fund has 213 people donated to it in the last 5 weeks. We're over $100,000 in that fund now. I think that speaks to the generosity of our community and the concern people have for people's well-being. So as humanly possible, we'll be using those funds to provide that pressure relief as needed and get as many people who are willing and interested inside as we possibly can.
Great. I have a question for you, Mr. Rivera.
Great. Yeah, thank you, Mr. Chair. Question and comment. So comment is, I really appreciate these reports every month at this committee. And I just can't overstate how sort of night and day this is from just a few years ago, where I remember being in the quote unquote war room, right? And we were talking about why the hell aren't these systems more integrated? And now everything is so much better than it was. I guess I have a systems level question regarding the safety center, and I agree a lot with the comments made by the chair about how the safety center has evolved, and it's amazing to see what's happening there. What is from a systems perspective, the optimal length of stay at the safety center? And I ask that because I'm wondering where the line is between the utilization of the safety center and utilization of these sort of other resources, and us sort of not tackling that question of our actual shelter capacity, and sort of where is that line of, you know what, we've used the safety center as much as we can. Now we really have to have this more difficult conversation around shelter capacity.
Through the chair, I'd love to answer this question. So because of integration and processes that we've put in place, this is what it looks like. People can walk in or be brought to the safety center at any time, but we primarily focus on a schedule of about 6 to 6:30 is when people will start coming in. So an individual that uses safety center as their shelter, because they won't go into shelter, they will come in around 6 o'clock after having dinner at Beans. They can stay the night, but at 7:30 in the morning, they're asked to leave to go have breakfast at Beans. Beans will hold them at the breakfast area. They then can go to the 3rd Avenue Navigations for anything, or they can do what they want to do during the day, and then they can come back. So we aren't encouraging people to stay 24/7 and use it as a shelter. But what we are doing is when we are identifying the individuals that are high needs and they're using the center as their shelter, we are then recommending and asking them to go to Linda's Place or 56th, and then we shuttle them there right then and there. So at 2 in the morning, if there are 5 beds available at Linda's Place, those individuals are requested to consider going up to Linda's Place because it's just right next to each other, really. It's only half a mile, and they'll be transported. So then we will fill the shelter bed and decompress Anchorage Safety Center. So that's what we are doing right now, if that makes sense.
Yeah, no, that totally does. I guess my question is, I guess asking it a different way, is there enough leeway in the system, enough movement in the system where we feel comfortable with the infrastructure that we have right now?
Through the chair, my recommendation is it is working. It's still a little exhausting every once in a while to keep this going, but I think we are systematizing it. And I think we just need to lean in a little bit more to make sure we're more efficient. But I think it is working right now.
And just to add to that through the chair, I think this winter really is, we're testing out this model where, we don't have a lot of people. I mean, we don't have big camps right now. We did have big camps last winter. So we right now are in a posture, and I love the Hope team to speak about what they're doing, of really trying to engage people kind of relentlessly and encourage them to come indoors. So, as we all know, it's very hard to count the number of people who are unsheltered. People are coming in and out of shelter, kind of what Kathleen described. And so we are really kind of testing our capacity. And I think the other thing that we're very aware of from the administration's point of view is that the money we put into shelter is money we're not putting into housing for people to get out of shelter. So we don't want to overbuild shelter. We want to have enough, but we also want to shepherd the resources towards options that help people become stable on a more permanent basis, whether that's transitional or permanent housing. So that's where we're at.
Did you get all your questions answered? Great. Ms. Baldwin-Day?
Thank you, Chair. I was actually just curious if Ms. Agnew-Benben would repeat those numbers for the number of chairs and beds we expect to come online at the SCS Crisis Stabilization Center and at Providence.
Sure. So in approximately June, South Central Foundation will open 16 chairs. So the 23-hour care is furnished with recliners and 16 beds. So 23 hours for the chairs, 2 to 7 days for the beds. And then approximately in October, Providence will open 12 chairs and 12 beds. And South Central Foundation is also doubling the number of detox beds that will be in that complex. And then I can do this after Ruth and Tanya talk, but we also have some micro units coming online.
Ms. Baldwin, did that answer your question?
Wonderful. Yes. No, that's perfect. Thank you.
Great. Okay, let's move on. Let's move on to the HOPE team.
My name is Tanya Vandenbos with AB's HOPE team.
And Ruth Adolph with the HOPE team.
I was not prepared to talk, but I can talk a little bit about AMDOT. It's the Anchorage Multidisciplinary Outreach Team. And I think we've been doing that for about a month now. We meet every morning with other outreach partners and service providers in Anchorage, and we kind of plan outreach based around that. It allows resource sharing, which is great. And yesterday, I know we're short on time, so I just want to share kind of what happened yesterday with Town Square. We had a handful of people that we've been outreaching pretty frequently for about the last month, and we were able to call Kathleen to use some good neighbor funds to help I'm stuttering, so let me start this all over again. So do an outreach at Town Square, and we were able to get some groups of folks back to Beans Cafe, which is where we're kind of AMDOT is housed at. So that's where we meet every morning at 8 o'clock, which everybody's welcome to join that. And kind of triage folks in an emergency situation to figure out what was the best service for them, like what opportunities, what shelter beds were open, what worked for them. We had other outreach workers with us that day as well. So True North was with us. I think the amazing thing to see was just this space that we shared, and we were able to bring those folks from Town Square into this space where they could be warm and they could just sit down and take some time to themselves while talking to all the outreach workers that they had already met. And so there was relationships built. They helped we all transported from Town Square to Beans Cafe, continued the conversation about what are your needs? What would you like? What do you want this to look like? True North was able to help facilitate treatment for one of them, which we dropped them off this morning right before this meeting. So that was great. They got into detox. 4 people went into shelter, all 4 that we brought from Town Square. They all got into shelter. They're all there today. We checked on them this morning. So that was pretty amazing. I feel like I'm missing a lot here. So I don't know if anybody else has anything to add, but.
Just to add that I think with the collaboration with all the partners that we have on MDOT, it's been a really cool thing to see unfold because it's real-time problem solving. When we go out and do outreach in the camps or in the woods, and we have somebody that has a need, we can now say we have somebody that we can reach out to right then and there, and we will figure out a solution before we leave. Or if it's not possible, we have now a place to go take that person to. And there's so many different opportunities now that we've never had before that makes problem solving so much easier and so much better, and truly serves the people that are wanting to help and wanting to engage with us. So another cool example too for putting somebody into a hotel, we have somebody at the Q-In right now we have helped them kind of get on their feet. They haven't been inside for 10 years. They are now paying for half the rent. So we're making a plan to actually make them self-sustainable. So he's helping us pay for the rent, and he's making plans to move forward and working towards self-sufficiency. So really it's a case-by-case basis, and people that are engaging with us, we are seeing like a lot of cool things unfold.
These guys are being extraordinarily humble. This is a lot of work, but it's working. And I get very excited about the AMDOT meetings at 9 in the morning because that's when decisions are made and then we operationalize them during the day. So I am proud of what they've created, and it's another example of complete integration.
And this is I'd just like to add from kind of where I sit, what's wonderful about this is that, for quite a long time, we've had a number of community agencies that do outreach, the VA does outreach, we have a lot. And I think in some ways, when we had pretty established camps, it was a little bit easier to know, like, okay, we're going to go there on Tuesdays and, to kind of have a schedule. And the landscape has really shifted, and we do need to be more nimble and be really going out and engaging people. And that's really the attitude and the skill that the Hope team and Kathleen and Emily really bring. And also what we're able to do is kind of share information better. So we get a lot of reports from the community about locations where they're concerned about people, or they, concerned about a camp. Now I'm funneling that information to the MDOT, so then they can kind of help deploy all of our community partners to those locations on a sort of more week by week basis. So I think it's just really helping us adapt and find people where they are and start that relationship building that Ruth and Tanya were talking about, which is what it takes for folks who aren't trusting and have been outside a long time to want to come inside.
And I think we've hit both of these, but the multidisciplinary, well, you were referring to this. This is in part this meeting that happens in the morning. And can you just talk a little bit more about what's going on there? Like, what is the multidiscipline outreach update, which I love and don't love that name, but what is that, and what does that look like? And because I think that's what you're referring to. Is that right?
Yes, that's what I was referring to. So all of the
I want to
partners-
switch mics. See if the other one's better, because that one's giving us lots of trouble.
Yeah, is that better? Yeah. So all of the partners attend. So we've been working on this for about 6 years or 6 months, I'm sorry. And then we just kind of started the AMDOT meetings about a month ago. So just a little the backstory is when Hope first started a year ago, we met with all the partners and said, where do we fit in? What does our community need? What should it look like? We have a lot of great people doing a lot of great work, but how do we facilitate that to reach everybody in Anchorage that we need to? And from that came this idea of, we should all meet more regularly. We should coordinate more. We should talk more, all of the things that we weren't doing, right? And so from that, everybody said, well, we would love to meet daily, figure out what our plans are. And that's exactly what happened. So we have a standard agenda. We talk about wins, because that's, amazing. We love to hear about those. But then we talk about, what does outreach look? Who's available today? Where should we go? Where are the priority areas in Anchorage? In the last couple of weeks, it's been extremely cold. So one of the focuses in our MDOT meetings have been, where are the most vulnerable? Maybe that doesn't look like someone in camps, but maybe that's these folks outside who aren't dressed for the weather, who are in downtown area, the town square area, which is why we focus so much in those areas these last couple of weeks. But that's all discussed in the morning meetings. One example is we had a gentleman who's trying to get into treatment. He needs meds before that can happen. In this meeting, we have several medical providers, and so we're able to say who has the ability, the capacity to see him now, so that we can move this forward quickly. So we're able to do that. We have treatment folks online to talk about, is there openings, who has openings there today. We have housing available, so if someone is up for housing or someone is looking for someone for housing, we have that. We have behavioral health is on there, so if someone needs, there's just a whole realm of people every morning at 9. So worst case scenario, if someone is looking for something, they literally just have to wait till 9 o'clock the next day. And that's if we can't figure it out in the moment, so.
Thanks. And you guys are meeting over at Beans. Is that the current place? Okay, great. Okay. Any other questions from the members at this point? Let's see. Oh, I still have, Aaron, then Ms. Baldwin, did you have another question?
Oh, no, I was just saying that microphone is still not wonderful for those of us who are on the phone.
yeah, it's not wonderful for us in the room too.
I was gonna have a comment, Mr. Chair. I just want to say thank you so much for the work you guys are doing, and it's really impactful, and you're saving lives. So thank you.
That's great.
And also
Okay. Great. Yes. Go for it.
Thanks, Chair. This is Thea again. Just some really quick other updates. Already mentioned the Good Neighbor Fund, over 200 donors, over 100K so far. We'll be meeting with the Federation of Community Councils tonight to share the opportunity with them. Micro units, we had our ribbon cutting last week. There's 24 units constructed on site, along with the community building, the 2 offices, and the toilet shower block. During this month, the contractor will be constructing 8 additional units using the additional funding that we secured, along with, excuse me, the ADA ramps that will help make the common spaces and some of the toilet areas accessible. Those should be installed by the end of December. And we're just waiting on the intent to award to be published by purchasing, which we feel like should be any minute now, for you all to know who the selected contractor is that will be operating the units. And then we're going to have them working with the contractor just a little bit over this month so that any kind of last minute modifications can be made. And then their goal is to start bringing people into that program that will be operated at the micro units in early January. So that's very exciting. Jed didn't mention this when he presented, but we are now working on bringing the Housing Rehab Fund forward to the Assembly. Since we're going to be using some previous year's CDBG and home funds, you're first going to see it through a substantial amendment. And then after that, did I say that right, Jed? Yes. And that's a 30-day comment period. And then after that's done, we'll be bringing the Housing Rehab Fund concept forward to you. I also want to mention that the same day as the micro units opening, so last Wednesday, the municipality helped Pastor Adrian and her organization to demolish a structure on her property in Mountain View at the intersection of Peterkin and North Flower. It's a little bittersweet because it's a building that's been there for about 50 years, and for a very long time it was a childcare. So many people in Anchorage, and especially in Mountain View, have fond memories of it. It had become a dangerous building. Anyway, it's now been demolished. That occurred through a stipulated agreement with the municipality. So we assisted with the cost for the demolition. And then within a certain period of time, her organization has agreed to redevelop the property. So we'll be excited and looking forward to that. I also want to mention that at the next Public Health and Safety Committee meeting, we'll be bringing forward our crisis system data dashboard. And that actually has a lot of the safety center information that you were asking about, Member Rivera. And then we are hot working on our homelessness and health dashboard that we will be bringing kind of a pretty good rough draft to you, hopefully at the January meeting of this committee. Last thing is we were, as the Muni, we were a little bit out of the loop on the evacuees for a bit because they had been moved into hotels and work was happening that didn't really include the municipality. But in this last few weeks of December, many of those households are now moving from hotels into housing. And some of them, of course, will be staying in Anchorage. So we've tapped back in. We're working with the entity called Tidal Basin, which manages those non-congregate sites, so that we're able to loop people into community resources. We have some of our faith community folks who were very helpful at the beginning of the emergency, tapping back in and getting connected with those households, as well as working with our tribal partners. That's it.
Looks like battery's dying. Well, thank you. I want to make sure we have time for public comment. I will just say that this again. I repeat the thank yous. The thank you for the incredible work you're doing. It's making a difference. This is a night and day from what we've seen in the past. So thank you for your hard work. Thank you for your collaboration. And I know that there's still that the question that's on my mind a lot today and these days is how many people are out there and how do we help to make sure that they're safe? And that I think is the thing that really is, I continue to struggle with. And I know that it's difficult, and I know that it's sometimes folks don't want to come in because we don't have the right scenario for them, or there's a variety of reasons. But that's the piece that I think is continuously concerning for me is in these days that it's cold and it's windy and they're exposed. And so that's something that I want to continue to challenge us in with our outreach teams and our data is we're a small enough community. At some point, we should know pretty much everyone who's out there, whether they can or want to come in. I hope we get to the day where we're able to track most of them, and so we can make sure that they're safe. So thank you for being here. Thanks for your work. Okay, we're going to make sure we have time for some public comment. Any other comments from members? I don't see any questions on the phone. Okay, Travis, can we set up a microphone for the front there? And Scott, I'd love for you to come up if you want to have 3 minutes. Scott there in the back, and tell us about the. No, you're not going to do it. All right. Okay. You came all this way. You don't want to talk, huh? All right. Okay. Jamie, you're up. 3 minutes. Share your name for the record. Thanks.
All right, there we go. Jamie Lopez, East Anchorage, formerly Coalition, formerly Homeless. Man, is there a lot of feedback on these things?
Yeah. I don't know if the suggestion was to aim it down. I don't know if that did that work for you. I don't know.
Test.
Oh yeah,
Okay.
that's
No, still going. Yeah. Well, I don't know if it's proximity to RF devices or something like that, but she had a radio on too. It's weird. Yeah. I think it's good. So, all right. Do I get my time back, sir?
We can reset.
All right. Jamie Lopez, East Anchorage, formerly Coalition, formerly Homeless. So, it's another month. Where do I go with this? So, you had the ERA funds, Emergency Rental Assistance, ended September 30th. And boy, this microphone. So,
Jamie, why don't we try this?
Wait.
Wow.
Will it still pick you up if you're far enough away from it? Because we could try that. Just sit down, and then I'll stand away from it or something to that effect. So, all right, I sit away from it. Okay. We'll try it again. All right, we get 2 microphones. Okay, I think that's good. All right. Jamie Lopez, East Anchorage, formerly Coalition, formerly Homeless. Do I get the time back? Okay, and so anyways, where do I go with this? The ERA, the Emergency Rental Assistance Funds. So they ended September 30th. And essentially, in a report given by Jed back on August 20th, there were 275 people experiencing homelessness right in early August that had been taken from the streets and put into housing. And so there were more since then, obviously, but then the question becomes, is it going to be successful and effective? And chances are it's probably not. Any number of people who have been on the streets for any period of time, they have so much PTSD racked up that if you place them into housing within a period of months, they're not going to become functioning members of society. It's a simple fact. You have so much, and expecting people to land on their feet is just not realistic. So a lot of those people are probably going to end up back outside. You never actually got the results from Project Next Step. And so that was sort of papered under. I knew people that were in parts of town that were in that program and then ended up back outside. And that was a year-long program with case management, and that was done the right way. So aside from this, I could talk about this for hours, and I think you know that. I was sort of semi-asked to join the MDOT, and I will not. And the reason why is because leading with law enforcement, it's not the way. It's nothing against Ruth Adolph as a slight. I think she's a really nice lady. The problem is it's a barrier to people that are outside to getting services. There are any number of people that have been traumatized by law enforcement. And if you lead with law enforcement, there are people that will not accept services at all. Now, maybe if you're doing this in LA or Arizona or anywhere else where it's a warm weather climate, that will work. But in here, there are consequences to that sort of policy where people will get frostbite, people will die. and they won't get housed. And so with the displacement policy right now, and people getting endlessly displaced, they, HFC, Sierra Housing Voucher Wait List, within 2 weeks, if you don't respond, bam, they're on to the next one. You lost your housing opportunity. You're a criminal now, essentially, if you can't pay mortgage or rent. So aside from that, you have the anti-camping dashboard. And if you look at it, my phone went off, but it essentially said, if you look at the latest results from November, hold on a second. All right. Let's see if I can pull this thing up. Okay, it said 46 arrests, 325 voluntarily complied, 29 accepted services. That's a 10%, less than 10% rate. And so really, when you have years of trauma, or you're not going to get in a car, with a law enforcement officer. Very few people will. Say you end up in the hotel or a shelter, you get kicked out right back outside. Well, you just got in a car with a police officer. And same thing, with just going up and talking with police. And so really, this needs to be a health department vehicle, fire department, something to that effect. And it needs to be proactive engagement. I could talk about one other thing, since obviously the time. Essentially, you just approved 25 beds at the emergency meeting, and you increase capacity to 50. There are hundreds outside. And so what ends up happening is Ruth and Tanya were covering this briefly during the Homeless Prevention Response System Advisory Council meeting. And they talked about the fact that they see people outside, lots of people, and they're not getting help. And so what ends up happening? Oh, we're at the point we have to stop. Okay. So just gonna button it up. Okay, so the main thing I'm getting at is they're starting to learn things I've known for a while, that there's a shadow population out there. And so this is working for the people that are in this room. It's not working for the people outside. And until you're out there daily and nightly and going out at all times and all hours, you're not going to truly know what's going on. So
Thanks.
Thank you very much.
Thanks for being here. Is there anyone else who'd like to testify at this time? Is it second chance? Scott, you want to come up, say hi? No? Okay. All right. Okay. I don't see any other questions or comments. For the record, thank you all for being here. This is our last meeting of the year. So I hope you have a wonderful holiday season and have a happy new year, and we'll see you in January. Thanks. We are adjourned. I forgot to